Welcome to Indian Anatomist. Individuals who wants to perceive career in medicine are welcome to check out the YouTube channel Indian Anatomist. Today's lesson is part of ongoing lecture series, and the subject is general anatomy of skeletal system. What is skeletal system? Skeletal system serves as a framework for the rest of the body to rest on. Now, what are benefits of skeletal system? They provide shape and structural support, production of blood cells, organ protection, and mineral storage. The skeleton is made up of bones and other connective tissues like cartilage, tendons, and ligaments. A different name for it is the musculoskeletal system. Skeletal tissue is derived from mesoderm. This is a part of the current lecture series on general anatomy. First, I will now explain how bones are classified. In general, the bones are classified: 1. According to their position or region. 2. According to size and shape. 3. According to their structure, and 4. According to development. Number 1, the bone according to their position are categorized into two main groups, namely, the axial and appendicular skeleton. Number 2, the bones are categorized into 7 types based on their size and shape. They are long bone, miniature of long bone, short bone, flat bone, irregular bone, pneumatic bone, and sesamoid bone. Number 3, the bones are developmentally classified into membranous, cartilaginous, and membranocartilaginous bones. Finally, number 4, classified according to their structure, is compact and spongy bones. Axial skeleton forms the axis of body, or the bones located in the midline. Out of 206 bones in adult human, the axial skeleton comprises 87 or 80 bones. That includes 22 skull bones, 6 ear ossicles, 1 hyoid bone, 1 sternum, 24 ribs, and 33 vertebrae. The vertebrae are further categorized into 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 4 coccygeal vertebrae. The 5 sacral and 4 coccygeal vertebrae undergo fusion, resulting in the formation of a single sacral and coccyx vertebra, respectively. Now, appendicular skeleton. Appendicular skeleton includes 126 bones, consists of the bones of the upper limbs, responsible for the manipulation and grasping of things, and bones of lower limbs, enable mobility. In addition, it also comprises the pectoral or shoulder girdle, that contains paired clavicle and scapula, and pelvic girdle comprises paired hip bones, which serve to connect the upper and lower limbs to the body correspondingly. The upper limb consists of a bilateral arrangement of skeletal elements, which comprise 2 clavicles, 2 scapulae, a pair of humeri, as well as the radius, ulna, 16 carpals, 10 metacarpals, and 28 phalanges. The lower limb comprises 2 hip bones, a pair of femurs, tibia and fibula, patella, 14 tarsals, 10 metatarsals, and 28 phalanges. Next, I'm going to talk about how to classify bones based on their size and shape. Dear students, you will get a lot of test questions from this classification. I previously posted a clinical, multiple choice question video on bone size and structure. Refer to the description box for the link. What are long bones? Long bones are cylindrical and longer than the other types of bones. These kinds of bones are found in the limbs or extremities. These bones act like levers and help us to move by working with different muscles. Examples for long bones are humerus, radius, ulna, femur, tibia, and fibula. Because each of the long bones are solid and substantial, the human body is able to move around without restriction. The following components that make up every long bone in the body, are, epiphysis, diaphysis, metaphysis and epiphyseal plate. The human body's long bones are all arranged in a vertical orientation, with the exception of the clavicle, also known as the collar bone, which is laid out in a horizontal orientation. Now, what is epiphysis? The epiphysis, also known as ends, it is always 2 in number, for each long bones, that is, upper or proximal end, and lower or distal end. Each epiphysis ossifies from more than one secondary ossification centers. The diaphysis, also known as shaft of a long bone. It ossifies from single primary ossification center, except clavicle, which has 2 primary ossification centers for its shaft. The shaft consists of outer compact bone with central medullary cavity or canal that is filled with bone marrow. In adults, red bone marrow is replaced by the yellow bone marrow. Now, what is metaphysis? The extreme ends of diaphysis, or shaft, are called metaphysis, which meets at the epiphysis. It is the zone of active growth. What is epiphyseal plate? The epiphyseal plate is present in children and adolescents, before the ossification of long bone. In adults, growth ceases, and the plate is replaced by an epiphyseal line. The epiphyseal plate, or growth plate, or simply, physis, is a hyaline cartilage plate that joins the metaphyses and epiphyses of a long bone. This is the site where the new bone remodeling occurs. Girls' epiphysis, epiphyseal plate, and metaphysis usually fuse at 12 to 14 years old, and boys at 14 to 17 years old. The picture, displaying the X-radiograph of knee joint of a young children, showing a gap present between the metaphysis and epiphysis. This gap is occupied by the epiphyseal plate, made of hyaline cartilage, which is radiotranslucent, so appears black in color. Can an X-ray confuse a growth plate for a fracture? An ossified bone growth plate in a young children can imitate a fracture. Towards left side, X-radiograph image, showing the unossified shaft, with separate metaphysis and epiphysis. Black color gap representing the epiphyseal plate. At the same time on right side, in adults, the metaphysis and epiphysis are completely fused, and the epiphyseal plate is replaced by epiphyseal line, remnant of growth plate. At this point, you all know about the parts of the long bones. Long bones are important for humans because number 1, it works with ligaments and muscles to move the upper and lower limbs. Now, all 3 work as levers to lift the weight and move faster. Number 2, it stores calcium, phosphorus, magnesium, and salt, all of which are needed for the body to work. 3, hematopoietic, meaning that it makes red blood cells, white blood cells, and platelets from the bone marrow. Next is miniature or short long bones. Why are they referred to as short long bones? The metacarpals of hand, metatarsals of foot, and phalanges in both the hand and foot are some examples. These are regarded to be long bones, but they are not true long bones. Since actual long bones always have 3 parts, an upper epiphysis, a lower epiphysis, and a middle shaft. Whereas, short long bones each have only 1 epiphysis, and a long tubular shaft, the diaphysis. The opposite end looks like an end, but it is the continuation of the shaft, also referred as pseudoepiphysis. Now, short bones. Always, the short bones, whose length and width are approximately same but with different shapes. Their main job is to give support and stability, while moving as little as possible. These bones only have a thin layer of compact bone on outside, with inner cancellous bone, with lot of bone marrow. It takes the shape of cube, trapezium, scaphoid, or boat shape. The examples are carpal or wrist bones, and tarsal or foot bones. What is flat bones? Flat bones are strong, thin plates, that protect essential organs, and support muscles. Cranium, scapula, sternum, ribs, and hip ilium are flat bones. The center is cancellous or spongy bone, with varied proportions of bone marrow, whereas the outside and inner parts are compact bone for protection. Flat bones create the most adult red blood cells. Now, what is irregular bones? Irregular bones are those in the body that do not fit into any other group because of their variable shape. Some examples of these are the vertebrae, sacrum, and mandible or lower jaw. They are mostly made up of cancellous bone in the middle, and with a thin layer of compact bone on the outside. What are pneumatic bones? These are special type of bones, found only in human skull bones, and many in bird skeleton. Pneumatic bones are characterized by the presence of an internal cavity that is filled with air. In the context of human anatomy, these bones forms, the paranasal air sinuses, are associated with the nasal cavity as they envelop it. Pneumatic bones includes the maxillary bone, frontal bone, sphenoid bone, and ethmoid bone. The atmospheric air can freely flow through these sinuses during respiration and cools the inspired air. It acts as a resonance of voice and reduces the weight of the skull. These images elucidate the anatomical arrangements of pneumatic bones. Specifically, the bones involved in the formation of the paranasal air sinuses. The final type of bone, from the classification, according to their position, is sesamoid bone. What are sesamoid bones? Sesamoid bones are a type of small, distorted bone, that grows from a muscle tendon. There is no periosteum and these are not real bones. Their job is to change the amount of pressure, reduce friction, and sometimes change the direction of a muscle pull. The patella or kneecap, pisiform, one of the carpal bone, and two small bones present at the head of the first metatarsal in the foot, are the most obvious examples of this. Students, we have completed 2 bone classifications. 2 are still waiting. In the next discussion, third category of bone classification will be studied, focusing on their developmental or embryological characteristics. According to this classification, the bones are further classified into 1. Membranous, or dermal bone. 2. Cartilaginous bone, and 3 is membranocartilaginous bone. First, I will discuss about the membranous bone. Before, you people should know about the term ossification. Now, what is ossification? The bone formation, also called ossification. It is the process by which new bone is produced. Ossification begins about the 3rd month of the fetal life in humans, and is completed by late adolescence. Intramembranous bone, that ossifies directly in connective tissue membrane, without previous existence as cartilage, and they are also called as dermal or investing bones. During membranous ossification, the mesenchymal cells from neural crest, which are special type of ectodermal cells, that multiply and form the bony nodules. Capillaries, osteoblasts, and bone precursor cells develop from these cells. The pre-bone osteoid or matrix calcifies, because osteoblasts release a proteoglycan collagenous matrix, that binds calcium salts. In addition, dense mesenchymal cells create the periosteum around all calcified bones. The inner periosteal cells also become osteoblasts, and deposit osteoid or matrix. Thus, multiple bone layers form. Examples for membranaceous bones are frontal, parietal, part of occipital and temporal bones, mandible, maxilla, and clavicle except its medial end. What is cartilaginous bone? During cartilaginous bone formation, hyaline cartilage model is changed into bone. It starts when mesenchymal cells change into chondrocytes, which are the cells that make cartilage. Then, osteoblasts make a thicker area of solid bone in the shaft or diaphysis, and the growth plates or epiphyseal plates of cartilaginous bones. Then, chondrocytes multiply quickly and release an osteoid, which helps cartilage that takes the shape of bone. Later, the changed matrix lets hardening happen. This cartilage template makes it possible for blood vessels to grow in. The blood vessels also bring in osteogenic cells, which change the perichondrium into the periosteum. At last, after birth, this process is repeated, creating the bone that will remain in the body forever. Any idea about membranocartilaginous bone? In human body, some bones are developed partly from membrane and partly by cartilage. Examples are mandible, clavicle, occipital bone, temporal bone, and sphenoid bone. Now coming to last classification, in this, the bones are classified according to their structure. They are classified further into 1. Compact bone, and 2. Spongy or woven bone. Let's find out more about compact and spongy bone. Compact, or cortical, or lamellar bone, is denser and stronger than the spongy type. It forms the long bones diaphysis, that is deep to periosteum. The microstructure of compact bone is called an osteon, or Haversian system. Osteon contains main lamellae, that are concentric rings of calcified matrix. Blood, nerve, and lymphatic vessels run through each osteon's central canal, or Haversian canal. Now, each lamellar rings have lacuna with single, mature bone cells or osteocytes. Narrow, branching canaliculi link lacunae. These canaliculi hold nearby osteocytes protoplasmic processes that join via gap junctions, so the central canal, allowing blood to exchange nutrients and waste. Now I'll talk about a spongy bone, which is the last type of bone in the structural classification. What is spongy bone? Spongy bone, also known as cancellous, or woven bone, exhibits a lower density and weight compared to compact bone. Spongy bone is composed of trabeculae, or bony bars, that are in close proximity to small, irregular cavities that housing the red bone marrow. The trabeculae within spongy bone exhibit a structural arrangement that is oriented along the lines of mechanical stress, allowing for potential realignment in response to alterations in stress direction. The canaliculi in spongy bone establish connections with neighboring cavities in order to receive their blood supply. There is no Haversian canal, like compact bone. Although the arrangement of trabeculae may initially seem random, it is actually structured in a manner that improves strength, similar to the careful positioning of braces in architectural support systems. Example, all the ends, or epiphysis of long bones, skull bones, ribs, hip bones and vertebrae. Dear students, till now I have explained about the classification of bones. One category includes long bone. Dear students, I explained about the epiphysis, metaphysis, diaphysis, and epiphyseal plate of long bones. The video will not conclude until the blood circulation of long bones is discussed. Now, I will explain to you how long bones get their blood supply. Stay watching. What is purpose of blood supply to long bone? 1. Bone remodeling. 2. Bone repair, and 3. Bone homeostasis. This is applicable to all the body tissues. How do long bones get their blood? Blood supply of the long bone accounts for 5 to 10% of the cardiac output. A typical long bone receives blood supply from various sources. They are the nutrient, epiphyseal, metaphyseal, and periosteal arteries. The nutrient artery supplies directly from major systemic arteries present adjacent to it. Nutrient artery is a high-pressure system that comes from the systemic artery, closer to the shaft. It enters into the marrow canal of the long bone, through the nutrient foramen. In the canal, it splits into two, that go up and down, and get closer to metaphyses. As these branches move up and down, they give off small parallel arteries called radial branches. These radial branches bring blood to the bone marrow, and inner two-thirds of the diaphysis. Both the ascending and descending branches meet at the metaphysis. From there, they split into smaller spiral branches that connect to the metaphyseal and epiphyseal arteries. Periosteal arteries are low-pressure system that abundantly situated deep to the attachments of the skeletal muscles and ligaments. They branch out beneath the periosteum, which is the covering of the bone, and are connected to the Haversian and Volkmann canals of the Haversian system, a microscopic system. The periosteal branches are responsible for supplying the outer one-third of the shaft of long bones. In adults, particularly in short long bones, the periosteal vessels are responsible for providing the blood to majority of the bone, rather than the nutrient vessels. Now, what are metaphyseal arteries? Metaphyseal arteries arise from nearby systemic vessels, and directly enter the metaphysis. It supports the nutrient arteries, ascending and descending branches. These anastomosis, or arterial union, with the spiral arteries, making the most vascular area of the long bone. Metaphyseal plate, and epiphyseal fusion, creates the vascular anastomosis. This is very important in adult long bones, because this vascular anastomosis prevents the osteomyelitis. The epiphyseal growth plate nourishment originates from metaphyseal and epiphyseal perichondrial arteries. Now coming to the epiphyseal artery. The non-articular region of the epiphysis in long bone is the source of the epiphyseal arteries, which themselves originate from periarticular vascular arcades or circulus vasculosus. These non-articular surfaces have many vascular foramina, although only a small number admit arteries, that is, epiphyseal and metaphyseal. The rest serve as venous outlets. It is possible that the relative vascularity of the two ends of a long bone can be inferred from the number and size of these foramina. This is a schematic picture showing the pathway of periosteal artery. It enters into the compact part of long bone through horizontal perforating Volkmann's canal and vertical Haversian canal. Through this, the blood perfusion occurs in outer one-third of the shaft. This is a schematic picture showing the pathway of periosteal artery. It enters into the compact part of long bone through horizontal perforating Volkmann's canal and vertical Haversian canal. Through this, the blood perfusion occurs in outer one-third of the shaft. This is the area indicating the anastomosis of all the arteries, that is epiphyseal, metaphyseal, periosteal, and nutrient arteries. This type seen in adult long bones after the completion of ossification. Because of this anastomosis, the bone ends, establishes the collateral circulation, that is the power of anastomosis. At the same time, in children's, before ossification completes, the blood vessels are separately supplying the independent area of long bone, and no anastomosis occurs. Because of this, during any lesion of the particular end of long bone, leads to avascular necrosis of long bones, or short long bones. Now coming to venous drainage of long bones. These veins are usually valveless, and nutrient veins accompany the arteries. In the medullary cavity, a central venous sinus is present, which is served by radial collecting sinuses. In general, the venous layout is fan-shaped with cortical sinusoids, radiating outwards, towards the periosteal surface. Each Haversian canal is supplied by a solitary venous sinusoid. Dear students, one clinical question to you all, related to blood supply of long bone. The question is, in children, the metaphysis is a frequent location of osteomyelitis. Why? Osteomyelitis means inflammation or infection of bone. Metaphysis is the area of very active growth of the long bone, and has rich blood supply. Before fusion of epiphysis with diaphysis, that is in children, the metaphyseal arteries are, and arteries that form, hairpin bends. The bacteria, or infected emboli, can be easily trapped in these hairpin bends of the metaphyseal arteries, causing osteomyelitis. At last, what are factors responsible for blood flow in long bones? These factors, also called as hemodynamic regulating mechanisms. They are as follows. Number 1, neural control. After sympathectomy, animals have more blood flow. So sympathetic innervation is essential for blood circulation. Number 2 is hormone control. There are alpha-1 adrenoceptors, muscarinic, and prostaglandin receptors, situated in the osseous system. Adrenaline may open arteriovenous shunts between nutritive arteries and sinusoids that drain into the central venous sinus, which increases transosseous venous return during exercise. Finally, number 3 is metabolic management. After ischemic healing, or healing after inadequate blood supply, the flow of blood goes up by 2 to 3 times. Dear students, I hope I have made myself clear to you all regarding this topic. Now, my colleague Sharmila will describe about the remaining part of skeletal system, that is, classification of joints. I will take a small break.
Dear students, the various bone classifications have been explained by my colleague, D.S. He detailed the long bone's anatomy and blood supply. Hi, I am Dr. Shamila, going to explain about the joint classification with suitable examples. Please monitor everything, and allow me to begin.
What is arthrology? It is a combination of two words. Arthro means joints, logy means study, so studying the joints are called arthrology. Now, what is articulation? It is a union, or junction between two or more bones, or rigid parts of the skeleton. Normally, the joints exhibits variety of forms and functions. Some joints have no movements. Some joints allows slight movements. Some are freely movable. Any physical type of joints, or human body joints, have axis. They are uniaxial, biaxial, and multiaxial joints. With this introduction, I will start today's session regarding the classification of joints. Generally, the human body joints are classified into 1. Structural classification, 2. Functional classification, and 3 is biomechanical classification. We will discuss about the structural classification. The structural classification is further divided into 3 subtypes. They are fibrous joint, cartilaginous joint, finally, synovial joint. Now, why joints are called fibrous joint? Bones are connected by fibrous tissues, that is, ligaments or membranes. Most of the fibrous joints are immovable type of joints. In human body, the fibrous joints are further classified into 3 types. Number 1 is suture. The sutures are seen only in skull. Different skull bones are held tightly by fibrous or sutural membrane. No movement occurs in these joints. Number 2 is syndesmosis. Articulating bones are parallel, united by flattened sheet of fibrous membrane or ligament. Slightly movable. Example, interosseous joints of radius ulna and tibia fibula. And third type of fibrous joint is gomphosis or peg and socket joint. This joint is present between tooth and alveolar socket of jaw bones, by fibrous or periodontal ligament. These are micromovable joint. This image shows the different types of fibrous joints, sutures, syndesmosis or interosseous joints, and gomphosis. Till now, we have seen different types of fibrous joints. Now, it is the time to discuss about the second type of structural classification, is cartilaginous joint. Why are these type of joints are called cartilaginous joints? Because the articulating bones are united by hyaline or fibrous cartilage. Partially or temporarily movable type of joints. Further, cartilaginous joints are classified into 1. Primary cartilaginous joints. Here, bones are united by hyaline cartilage. Usually temporary joint, present during the development of long bone. Example for this are epiphyseal plates of long bones, that uniting the epiphysis and diaphysis. Number 2 is secondary cartilaginous joints. Here the bones are united by fibrocartilage. They are strong, but slightly movable. The examples are joint between two vertebrae by intervertebral disc. This illustration shows two types of cartilaginous joints. The left one is primary cartilaginous joint, and towards right is secondary cartilaginous joints. Here is pubic symphysis is given as example for secondary. Synovial joints are the last category in the structural classification of joints. Synovial joints are the most common, and highly movable type of joints in the human body. These joints are lined by synovial membrane. Contains synovial fluid, rich in polysaccharide materials. Because of hyaluronic acid, the synovial fluid is viscous in nature, thus reduces the friction, and allows free and smooth movement between bones. This synovial fluid nourishes the articular cartilages and articular ends of bones at joint. This animated image showing the general structure of synovial joint. Dear students, see the free flow of synovial fluid in the joint cavity. Now, what are the key features of synovial joint? Number 1, in all the synovial joints, whose articular surfaces are lined by articular cartilage. It is mostly made of hyaline cartilage. Number 2, the synovial cavity. This cavity lined by synovial membrane, that secretes synovial fluid. It provides lubrication, nourishment, and shock absorption to the joint. Number 3 is joint capsule. In all the synovial joints, there is a fibrous capsule, which present outside the synovial membrane. It provides stability to the joint. Now coming to number 4, the ligaments. These are made of dense connective tissue, present outside the joint capsule, sometimes and inside. These are stronger structures, reinforcing the joint, and provide stability. At last, bursa. In plural, bursae, are small pocket-like protrusion of synovial membrane with fluid, that reduce the friction between tendons, ligaments, and bones, near the joint. The synovial joints are further classified into 6 different types, based on their structure and range of motion. They are 1. Plane or arthroidal joint. 2. Hinge joint. 3. Pivot joint. 4. Saddle, or cellar joint. 6. Condylar joint. And finally, 6 is ball and socket joints. This is highly advanced type of joint, at a time, produces different types of movement in combination. What is plane or arthroidal joint? Also called as gliding or sliding joint, movement occurs in single axis or uniaxial, facilitates single movement at a time. Both articular surfaces of the bones are flat or slightly curved, so the bones slide over each other. And the examples are intercarpal joints and acromioclavicular joints. The following are some pictorial examples of the plane, or sliding, or gliding, or arthroidal joints. Next is hinge joint. What is hinge? Dear students, daily we are seeing the hinge, somewhere in the house, or other working places. The hinges are the affixed, small metal plates that allow doors, lids, and other movable parts to rotate or to close and open. It is a flexible joined structure allows seamless swinging. Like the door hinges, some of the human joints behave like hinges, that is convex surface of one bone fits into the concave surface of another bone. The hinge joints allows movement in only one plane or uniaxial at a time. Commonest examples are elbow joint, knee joint and ankle joint. Some examples of hinge joints. Next variety is pivot joint. What is pivot? In physics, the pivot refers to a pin or shaft that a mechanical component rotates on. Some of the human joints are classified as pivot joints, and they are also named as trochoid joint. Pivot joint is a uniaxial joint that only allows rotation in one direction. One of the bones in that joint is fixed or stationary, while the other bone can move. This means that the fixed bone works as the joint's axis. Some examples are superior radio-ulnar joint and atlantoaxial joint. Dear students, here I have showed two different types of pivot joints. But both are showing that one bone is stationary, and another one is rotatory. The cross mark indicates the stationary bone, and the tick mark indicating the rotatory bone. My dear medicos, the last three types of synovial joints we talked about are uniaxial joints, which means that they only move in one direction at a time. Now, I am going to discuss about the biaxial joints. Now, saddle or cellar joint. Why joints are considered as saddle joint? Articular surfaces are reciprocally receptive in nature, that is, the opposing surfaces of joint are reciprocally concavo-convex. At a time, it produces two movements, because of biaxial nature. Mostly, flexion with adduction, and extension with abduction can occur in this joints. Example for saddle joints are first carpometacarpal joint, sternoclavicular joint, and incudomalleolar joints. The second type of biaxial joint is condylar or ellipsoidal joint. In condyloid type of joint, an oval-shaped condyle of one bone fits into an elliptical cavity of another bone. Condyloid joints allow movement in two planes that is biaxial nature, which includes flexion, extension, abduction, adduction, and circumduction. These joints do not permit rotation. The examples are wrist joint, metacarpo, and metatarsophalangeal joints, atlanto-occipital and temporomandibular joints. The provided image displays a few number of examples of the condylar joint. Now, the last and advanced variety of synovial joint is ball and socket joint. Ball and socket joint, also called as spheroidal joint, where the spherical head of one bone fits into a rounded socket or cup-like depression of another bone. These are freely movable type of joints when compared to remaining synovial joints. This joint allows for a wide range of movements because of multi-axial nature, which includes flexion, extension, abduction, adduction, medial and lateral rotations, and circumduction. The beautiful examples for this joint are shoulder joint, hip joint and incudostapedial joint of middle ear cavity. This accompanying visual representation depicts the examples of ball and socket joints. Dear students, with this we are completing the structural classification of joints. Two more classifications are left. So, I am going to discuss with this to you. Please stay back. Let me discuss the functional classification of joints. Functionally, the joints are classified into 1. Synarthrosis, permit little or no movement. Most of the fibrous joints comes under this variety. 2. Amphiarthrosis, permits slight movement, but more than synarthrosis. Examples are cartilaginous joints. And 3 is diarthrosis, permits variety of free movements. All synovial joints are diarthrosis. Final and third variety of joint type is biomechanical joint. In this type, joints are classified into 2. 1. Simple joint, formed by two bones, or with two articular surfaces, and the examples are shoulder joint, hip joint, etc. Number 2 is compound joint, means formed by more than two bones. Examples are wrist joint, knee joint, etc. Here are the examples of simple joints and compound joints. Dear all medical students, here we have completed the entire classification of joints, which includes structural, functional, and biomechanical classifications, also includes their subtypes. Hope you all studied well about the joints. Please you all, spare couple of minutes for the final touch of human joint. That is general movement of the joints. They includes 1. Flexion, 2. Extension, 3. Adduction, 4. Abduction, 5. Medial rotation, 6. Lateral rotation, and 7 is circumduction. For the entire explanation about these joint movements, please see my video regarding general movements in anatomy. The link is given in the description box and here too. Now, the session is completed.
Dear students, hope you all enjoyed this session. Please like, comment, share, and subscribe. Good day all.